We're going to look at multiplanar movement patterns in various joint structures. But first, a quick note about tensegrity. Unlike many objects and buildings, the integrity of the human body's structure is derived from the balance of tension members, not the compression of struts. This allows for the body to be dynamic, with the bones proverbially floating inside the soft tissues. As the muscles and fascia create constant pull forces and the bones present discontinuous compression, there is a constant synergy of opposing forces that create our structure. This favors the human body immensely. As Harvard physician David E. Ingber states in his work, The Architecture of Life, tensional forces naturally transmit themselves over the shortest distance between 2 points, so the members of a tensegrity structure are precisely positioned to best withstand stress. For this reason, tensegrity structures offer a maximum amount of strength. This, of course, makes the human body not only stronger physically, but also more resilient, adaptable, and better able to make efficient use of space. So, we will look at the planes of movement. We have 3 planes: the sagittal plane, which divides the body into left and right. We also have the frontal plane, which divides the body into dorsal and ventral portions. And finally, we have the transverse plane, which divides the body into cranial and caudal, or superior and inferior portions. These planes operate on different axes. An axis is a straight line around which an object rotates. Movement at the joint takes place in a plane about an axis. There are 3 axes of rotation. The sagittal axis passes horizontally from posterior to anterior and is formed by the intersection of the sagittal and transverse planes. The frontal axis passes horizontally from left to right and is formed by the intersection of the frontal and transverse planes. And the vertical axis passes vertically from inferior to superior and is formed by the intersection of the sagittal and frontal planes. Generally speaking, extension and flexion occur in the sagittal plane about the frontal or lateral axis, whereas abduction and adduction movements occur on the sagittal and anterior-posterior axis. Transverse movements generally occur on the vertical axis. We will demonstrate these planes and axes using movement. First, we will look at the glenohumeral joint and abduction. When we abduct, we move away from the medial line of the body, and adduction is a movement back towards the medial line. The abduction and adduction of the glenohumeral joint occur on the frontal plane about the sagittal axis. Next, lateral flexion of the lumbar spine. Flexion and extension refer to the size of the angle positioning of a joint. Extension occurs when the angle between body parts increases, and flexion occurs when the angle between body parts decreases. So we have a flexion and an extension. Again, reducing that angle size and increasing the angle size with the extension returning back to the midline. In the lumbar spine, we can do a lateral flexion and extension by doing a side bend, as I just did. This movement occurs on the frontal plane about the sagittal axis. However, most flexion and extension occurs on the sagittal plane about the frontal axis, as we can see with the knee. So, flexion of the knee decreases the angle of the knee, and the extension increases it. So again, flexion and extension. We can also look at protraction and retraction. Protraction moves a body part in the anterior direction, whereas retraction moves a body part in the posterior direction. With the shoulder girdle, protraction moves the scapula towards the spine, and retraction moves it back away. This stretch runs on the transverse plane about the vertical axis. Finally, we will look at the medial and lateral rotation using the hip joint. When a hip joint is being rotated laterally, it is being rotated away from the midline or externally. When the joint is being rotated medially, it is being rotated towards the midline or internally. So, laterally and back medially, and again, laterally and medially. So we can rotate externally and internally. This movement occurs on the transverse plane about the vertical axis. This concludes our exploration of movement patterns. I found this exercise to be extremely useful, particularly because of the opportunity to apply the theoretical concepts in a functional and tangible way. This also provided me with an idea of how these terms and concepts could apply during an actual training session, including specific movements that would apply, and encouraged me to start thinking about ensuring that all planes of motion are fully engaged during my training sessions.